Priyanka ma'am, sir has not joined.
Avi, ma'am, today Avi is managing the. Today Avi is the host.
One
अच्छा,
second.
okay.
नहीं मैम अभी
I
सर
think
एक नहीं
so Avi, I am also entering from the. I am also connecting from the laptop. Okay.
ओके नहीं नहीं नो नो मैम नो मैम
Managing the. Pratiksha ma'am है?
Yeah, no ma'am.
हाँ जी अभी
Pratiksha
नहीं
ma'am, are
ज्वाइन
you here?
और मैम वी
अभी
आर लाइव
अभी
ऑन यू हाँ जी
सर आ गए हैं शायद.
ओके 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 प्रतीक्षा यस डॉक्टर प्रतीक्षा जी
Right.
हाँ जी
Arun sir is here.
हाँ जी
Shall we begin?
Give me a minute. Let me in.
Ma'am, you are in.
यस मैम यू आर इन हाँ
Good morning, sir. डॉक्टर अभी
सर
YouTube लाइव वाला जो लिंक है वो
हाँ जी
शेयर कर
हाँ
देता
जी
हूँ.
हाँ जी
कंटिन्यू करो, मैं शेयर कर देता हूँ.
ठीक है वैसे मैंने शेयर कर दिया आप कर दीजिए थैंक यू सो मच
Rabia?
Yes, ma'am. Hello, everyone. Where there is a will, there is surely a way. In this uncertain environment of pandemic, it's important that learning continues, even if it can't happen in person. That's why BCIT is providing access to expert faculty and best practices. A very warm good morning to one and all present here. I feel privileged to extend my warm welcome to all presented here for the celebration of World Physiotherapy Week. Someone correctly said medicine adds days to life and physiotherapy adds life to those days. On this note, I, Rabia Hanif, BPT final year student from BCIT, wishes you all a very happy World Physiotherapy Day on behalf of whole BCIT family. World Physiotherapy Day marks the unity band solidarity of the global physiotherapy community, following with a week to generate awareness about the general contribution of the physiotherapists make to society, enabling people to mobile, well, and independent. As we all know, physiotherapy is one of the most emerging sciences in the world, helping many patients to return to their prior level of fitness and helps in managing various diseases. And that's why our college is celebrating World Physiotherapy Week. The theme for this celebration is Holistic Guide to Become a Professional. By keeping in mind the same theme, our today's webinar is on current prospects of physiotherapy and rehabilitation. I would like to invite Dr. Nidhi Kalra, officiating in charge of BCIP, without whom continuous support and guidance, this event would not have been planned and executed. She has not only been shaping the young building therapist, but also her constant efforts and guidance showed us that even in times of this pandemic, we can be creative and never stop learning. I would request ma'am to kindly share some word with us.
Thank you, Rabia. Good morning, one and all present and attending the event virtually. Respected Arun sir, thank you so much for being here, sir. Our guest for today, thank you, sir. Well, I congratulate everybody on this World Physiotherapy Day. This day is an opportunity for physiotherapists from all over the world to raise awareness about the crucial contribution the profession makes to keeping well, mobile, and independent. This day marks the unity and solidarity of the global physiotherapy community. Reports from around the world indicate the World Physiotherapy Day activities have a positive impact on the profession profile and standing with both the public and the policy makers. With the same thought, we at BCIP decided to celebrate this occasion throughout the week on the theme of Holistic Guide to a Perfect Professional. Yesterday was our first webinar, which was on Way Forward After BPT. And I'm very happy to share that we got a very motivating feedback from the participants. All the participants felt that it was a very useful session. Thank you, all the delegates, for motivating us. Hope we are able to continue with this same feedback throughout the upcoming webinars. On this note, I would like to wish you all a very happy learning. We believe that a little progress each day add up to big success, and we are sure that after this week you shall have definitely moved a step more closer to success and achieving your goals. I would also like to mention here that on this occasion of World Physiotherapy Day, BCIP is launching BCIP Revives Life. That is a kind of home exercise based program. That means we would be giving home based exercises programs for the patient and sharing it on our YouTube channel. I would like to congratulate the team effort behind the campaign of BCIP Revive Life, Dr. Ravi Chaudhary and her team. Now, I would just end the note on saying a happy World Physiotherapy Day. Thank you so much and all the best for all your future endeavors. Thank you.
Thank you so much, ma'am. Now, I would like to welcome our chief guest for today, Dr. Arun Kumar Agarwal. Dr. Agarwal is president of Sound Hearing 2030, ex-dean, professor of excellence, Department of ENT, Maulana Azad Medical College. He is medical advisor for innovation, education, and clinical excellence, Apollo Hospitals. Ex-additional director, General Health Services, Government of India, and ex-president of Delhi Medical Council. He is currently president of Delhi Council of Physiotherapy and Occupational Therapy. We are honored to have you with us. Now, I would request Dr. Arun to take over and share his words of wisdom with us.
Good morning to all of you. Good morning, Dr. Nidhi. Good morning, all the faculty members who are attending this activity, and to all the students, a very, very good morning and a very happy World Physiotherapy Week. When we celebrate a World Physiotherapy or a day or a week or of any kind, what is the main purpose of that? The main purpose of celebrating any such day or week is to remind us that we belong to this profession, we belong to this discipline, and at the same time, we are together. We have started our journey, but there is always a scope of more and more, whatever we can add, the best possible practices. And this particular day or week is the World Day. That's why it is important for us to look into the best possible practices all over the globe. That's why I always say, Nidhi ji, that can we try to pick up the best possible practices all over the globe? I know that the physiotherapy discipline in India is doing very well. I feel proud of that, the way physiotherapeutic science, the part of medicine is coming up and helping in looking after each and every patient. I feel proud, and I, at the same time, I will also agree when our young student started today's function that she said it is the most emerging science, and I fully agree that physiotherapy is such an emerging science that it has got unlimited scope. It has got unlimited scope. That means we have to develop ourselves. We have to find out how best possible we can expand our activity. I always say that physiotherapists can go into each and every part of the body, system, organ, any problem. It is not only the pains, it is not only the orthopedic problem, the neurological problem, the cardiac problem, motherhood, childhood, where in each and every, and these are really challenging problem for our country. I have been associated with your institute for a long time, and I have seen this institute coming up, developing, and perhaps I would like to say the outcome of the institute, one of the best of any institute all over India. I will like to say thanks to the director, Dr. Nidhi Kalra, and all my colleagues, all faculty for giving me this opportunity to be with you. And really, I'm missing, otherwise I would have also told you some lovely story, which I'm very fond of it. But today, perhaps I'll wait for a day when I'm there physically and sharing some lovely stories with my students. Thank you very much, Dr. Nidhi,
Yeah.
for giving me this opportunity. And I'm always with all of you. Thank you.
Thank you so much, sir. You have always been encouraging us throughout our journey. Thank you so much. Your words mean a lot to us. Like you have always been mentioning that the field is growing and it has avenues into various other fields. So keeping in mind the same thing, sir, in this week we are also having a session on renal rehabilitation, scope of physiotherapy
Very.
in renal rehab. So this is one of the recent advancements in which we are trying to, give a kind of insight of this topic to all the physiotherapists and the delegates. Thank you so much, sir.
I, 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 I feel very good. That's why I said into each and every system, renal problems. Thanks to diabetes, the number of the people suffering with renal problem are increasing so much.
Exactly.
So it becomes very important for our physiotherapy colleague to look into all the aspect where the physicians and your group can work together and the outcome will be the best. So I think I wish that any such venture, all the best. And with your permission, can I sign out now, Dr. Nidhi?
Yes, sir.
Is
Yes,
it
sir. Thank you
okay?
so much. Yes, sir. Thank you so much for sparing
And
your
I will
valuable time.
definitely like to, I will definitely like to have proceedings of each and every day, so that
Yes, sir. Of
we
course.
can also.
Yes, sir. Thank you so
So,
much, sir.
bye to all the students and
Thank
bye
you,
to
sir, for
all
joining us.
faculty and trainers.
Thank you, sir. Thank you so much.
Over to you, Rabia.
Okay, ma'am. Now we are proud to have alumnus with us, Dr. Pratiksha Arya, BPT passed out in 2010 from BCIT and MPT passed out from Swami Vivekanand National Institute of Rehabilitation Training and Research. She is working in CTVS CNS AIMS from 2015. She also worked for 2 years as PT in ESIS for 9 months in PGIMER. I request ma'am to kindly share some words with us.
Good morning to everybody, my teachers, and uh, Priyanka, especially who's been my junior and now has been serving as a teacher. I know it must be feeling very good to Priyanka to work in the same institute where she got her knowledge from. And I'm always so joyous to come on the platform of Chandiwala. Whenever I used to get time, I would come a lot to my institute. My teachers know that. I always feel so refreshed and all. And today, although virtually, but I'm again very happy to be with my alma mater to celebrate World Physiotherapy Day. And I don't know how much words of wisdom can I talk of. But yes, जैसे मैंने last year भी बोला था, this year again, जो upcoming physios हैं, I have just one message to give that see, कहीं से भी start किया हो, always strive for where you're going for, right? Your journey would be measured from where you have reached. So at this time, your goal should be, in simple words, just have good concepts and have a good vision, empathy for your patient, that you want to do best for your patient. I was currently I've been working in CTVS for last 5 years, but frankly speaking, I was not educated for that. I did my masters in rehab, bachelor's maybe. Obviously, we had exposure of cardio physiotherapy, but the real time working in ICU and especially a post surgical ICU like ours is very different from what we were taught. Initially, I too had a lot of depression that what would I do in this field, but now 5 years down the lane, I'm proud in to be in the place I am, because I am bringing out a difference in the patient's life. It's just not that physios can do passive movements or just active movements or just movement also. I'm telling you, the kind of place I'm working in, I have the decision of deciding the something as simple as nebulization and something as complex as diagnosing a diaphragm palsy, for which a patient may have to go for surgery or whatever. So what I just mean to say right now is strive to be best in what you are, in whatever, wherever you are, in whatever field you land up into, because still in our country there is a lot of difference in terms of what kind of education or what kind of exposure you would have at a bachelor's or master's level, and the kind of patients you'll have to work in your work arena. So don't be short-sighted, just be long-sighted, I would say, or have a diverse vision regarding work culture. That will make you a good therapist. That's it. But I'm just again, what should I say? I'm very happy to be part of my PCIP, and I'm so happy that the Chandiwala always remembers to call me in such cases. Thank you so much.
Thank you so much, ma'am.
Hi Priyanka, how are you?
Hello, ma'am. I'm great.
So is this completely virtual?
Yes, ma'am.
Nice. Are you done with your opening remarks?
Yes.
Oh, so I should get started. Okay.
Rabia, just take over.
Um, Thank you so much, ma'am, for the words. It's our pleasure to have you with us. Now, I would like to introduce our eminent speaker for this webinar, Dr. Hina Garg, who is going to share her profound knowledge with us. Dr. Hina Garg completed her Bachelor of Physical Therapy from India, Masters from Texas A&M University, and PhD in Rehabilitation Science. She is neurological physical therapist and an associate professor in the physical therapy program at Rocky Mountain University of Health Professions. In 2019, she was recognized by the Academy of Neurological Physical Therapy and the UTAH Valley Business Magazine as an upcoming business professional for establishing the Multiple Sclerosis Physical Therapy and Wellness Center. She and her colleagues continue to contribute significantly to the physical therapy and general community through their educational webpage. A very warm welcome, ma'am. Now, I would like you, ma'am, to take over the session.
Can you give me hosting rights?
Yes, ma'am. You can
Dr.
share
Hina,
the screen.
before you start, I would just like to extend a very warm welcome from our BCIP family. Thank you so much for accepting the offer to be one of the resource persons for this webinar today. And I would also like to congratulate for all the achievements that you have attained so far. It's so good, and BCIP is always proud of the alumni like you. Thank you so much. Thank you for being here. And I hope the information that you share, and especially at this time, I know it is late night there in US, and you have still managed to talk to all of us virtually. So I appreciate all the efforts that you have put in. And now you're here. I'm sure the knowledge that you would be imparting, the information that you would be delivering to all the delegates is going to be really, really great for them. Thank you so much, Hina. Thank you for joining us today.
Thank you, Kalra ma'am. You didn't have to say such kind words. Thank you. I'm very happy to be here. And BCIP is where I learned everything. So I'm very, very happy to be here and speak to everybody. So do I have hosting rights right now?
Yes, ma'am.
Okay, awesome. Are you able to see my screen?
Yes, ma'am. It's visible.
Okay, are you able to see the notes as well?
No.
Or just the entire present? Yeah, good. Okay, good. Thank you, Priyanka. I'll get started if that's okay.
Yes, ma'am. Sure.
Okay, awesome. So this slide is just a little bit about me. The next couple slides, I welcome everybody. I have a good presentation lined up. I hope you enjoy it. I had to do a little bit of research about this topic as well, because we're all practicing, and we get into the nitty gritty of stuff, and then we don't realize what are the current things that we are facing as physical therapists, as an entire profession. So I had to do a little bit of research, and I really hope that you enjoy this presentation. I'm going to talk about the current trends in physical therapy. And of course, you have my name over there, Hina Garg. I'm a physical therapist. I completed my master's, my PhD in the US, and I'm an associate professor at Rocky Mountain University. I'm also the MS Physical Therapy and Wellness Center director, and I'm a neurologic physical therapist. There's a few other specialties that I have. One is vestibular specialty, the other one is pelvic rehab, and apart from neuro and multiple sclerosis, aging specialty is the other one that I have. So since we all are very much wondering how I ran to the US from BCIP, I wanted to explore a little bit of the profession across the world. And I came to Texas, then I came to Utah, and I've been in Utah for the last decade. Utah is gorgeous. All the pictures that you see in the bottom, those are all from Utah. This is where I'm at. It's just in the backdrop of huge mountains. And I really have enjoyed living here, and I'm very happy to be here associated with the university, which is the Rocky Mountain University of Health Professions, and also practicing in the community rehabilitation clinic. This is not a great picture. The clinic is large. I just cannot seem to find good pictures in time. This is a clinic which is one of its kind in Utah County. It's run by donations, and it's an academic clinic, which is a collaboration between the university as well as Mountain Lands, which is a local organization. We have several specialties: orthopedic, sports, neuro, pediatric. I did not add, for some reason, pelvic, vestibular, and electromyography type, neuromyography type testing services. So all the physical therapists there working there are trained to practice in any of these physical therapy services. So I know that in the introduction, you didn't quite catch the name of the webpage. Me and my colleagues have created a free educational webpage. It's called ptexperts.com. Please go ahead and explore that webpage. There's a lot of information that we keep posting. Some of it is really about neuro and vestibular rehab and pelvic rehab. And we are posting more as we're going, but it's been a new journey. So we're very excited, and we would love to learn about how you explore the webpage and if there's any feedback for that. Okay, I wanted to get started about how physiotherapy currently looks in India. And this is where I had to do a little bit of research, because last I graduated, it was 2008 from Banarsi Das Chandiwala Institute. And it's already 12 years later. So I wanted to see what is the state of the profession in the entire country, as well as what are the colleges that are within the locality of Delhi or beyond. So I did not put up all that information, but I found very good 2 articles that sum up the entire state of the profession in India. The statistics run about 6.4 million physical therapy or other healthcare rehabilitation professionals that are needed currently in India. These statistics are from 2018. And the articles were also talking about what are the common challenges that are being faced within the country with regards to the profession at this time. The first one was how to adapt the learning or how to understand physical therapy relative to India's needs. So there's some context of cultural adaptations. I work in vestibular and pelvic floor rehabilitation fields, and there's a huge cultural adaptation and sensitivity that's required to be able to cater to the population related to these fields. So you need to have a very much adaptive way of how do you adapt this culturally or individually to the population needs in India. Ensuring quality across educational institutions. So one challenge that Grafton in 2018 found that the quality across educational institutions was still varied. And we all knew that, when I was there in 2008, that was the same story then. And professional regulation in 2015, after the IAP had some political split, the regulation of the profession in general, in terms of controlling for educational curriculums or continuing education or the standards of practice, has not been quite up to the mark, is what that article talked about, which might be, you all can educate me, and I'll make sure that I have some time towards the end so that we can have a good discussion about these findings. So professional regulation and standards of practice was one more challenge that was listed. Current needs that were identified by Indian physical therapists in India, practicing currently in India, having been either educated outside or within India. So the current needs listed from them were need for evidence-based practice, so being able to read research and apply current research findings, and then being able to do research, so being able to produce research or find clinical questions to research about. The third need was continuing education. So in several areas, there was need to establish the clinical expertise, as well as needing good quality continuing education. So there were a few things that I identified in these articles that were very interesting to me to realize where the physical therapy profession stands in India at this time. Now, there's several strengths to Indian physical therapists. You know, we're knowledgeable. We have the clinical exposure because of the volumes that we see. There's an rising awareness about the field, and we have better communication abilities than some other international physical therapists. There's a lot of weaknesses and threats that were identified as well in these articles. So the weaknesses included that lack of central counsel made it difficult for the profession to be elevated. The job market currently, the effort reward imbalance, the lack of social prestige, so the knowledge of the profession or the state of the degree or the knowledge of the degree professional is what they were referring to. So the how do you qualify? Are you working under a doctor? Do you have to take prescriptions from a doctor? Do you have to follow the doctor's protocol word to word? Can you change those things? That's where and the regular understanding within the society. That's where that was coming from. Future work projections. What do you do after physical therapy? That was it's not clear. People are not clear about what to do after, or how to be successful after. And then lack of access to research funding. Those are a little bit messed up. Lack of access to research funding to pursue research if there is any interest in that. There's a lot of opportunities. Those are kind of similar to what I had written on the left-hand side with the current needs, so I won't go there. But the threats for the state of physical therapy in India are home care agencies that have cropped up that are providing these services at home, which might not be the standard practice management that people are doing in outpatient or inpatient or skilled facilities. Then there was a term that was used, quacks. So physiotherapy quacks, people who probably were not having that quality education and therefore were still in the job market being hired, that forms a threat to the profession. So I wanted to kind of give you an overview of from 2017, 2018, where does this profession stand in India, and why it becomes important is in the next slides, we'll bring in research, we'll bring in evidence, we'll bring in what we need to know to move forwards within the profession. So World Physiotherapy or World Confederation of Physical Therapy, WCPT, I'm not sure if you all know about that. That's the oldest organization for physiotherapy, and they are the ones who named World Physiotherapy Day as September 8th. That's when they were established. I think it was several years ago, at least 50 years ago. So from their webpage, as well as doing a lot of research on my own, I realized that I think today we can focus our presentation on what are the new things that are happening in the profession, so that we are all motivated to address those challenges and meet the current need that we see in physical therapy. So the 4 trends that I've outlined, and now there's many more, I'm just going to dedicate my time to these 4. And again, if there's more questions, we can talk about that towards the end. So the 4 trends are use of technology in clinical practice. The second trend is tele rehabilitation. The third one is advancement of clinical specialties. The fourth, the last one, is what do you do after the degree, post-degree options. So for trend 1 and 2, I combined kind of some literature and the need in 1 or 2 slides together, but then we'll explore what those trends were in the next few slides as well. First, we need to kind of dedicate our time and focus here towards acknowledging that we're in this digital age, and then we need to make sure that the profession overall across the world needs to catch up with the technology. So the need for this is that regenerative medicine as well as genomic rehabilitation, where we're finding more and more causes or treatment options which are more technology based in our patients, and physical therapists can lag automatically if they're not knowledgeable about the technology. So you need to work very closely with the physicians, with the associated specialists, neurologists, whosoever you're working with, to understand the procedures that are being happening or the causes that are being established. So it really is a new frontier because we need to stay with the times. Then there's a need for innovation. There's more and more requirements for rural clinics. There's a need for remote monitoring, such as working with neurological patients. I always have to make sure that they're getting the neuroplasticity principles in their rehabilitation. So generally, I'm looking for more repetition, more salience, and more intensity of rehabilitation. And I'm able to establish a little bit in the clinic of those principles, but then I have to make sure that these patients are able to go back to their home and are able to sustain that level of activity as well as repetition. So remote monitoring has become a significant choice that's available to us, where I can monitor my patients or I can have them monitor themselves and report that back to me. See, that's very important because that is the key to long-term behavioral change. So if we do something for so long, it becomes embedded in our behavior. And that's the whole key over here. So we need to be very innovative as physical therapists to make sure that we're addressing these new areas that are coming up. Also, for innovation, you'll see in the next, I think, a few slides, information on sensors and robotics. So there's a lot of technology in practice right now. It's on the rise. It's very hard for me to keep up with it. I had to research a little bit some of these, depending upon the populations that you may work with. You may have to learn a little bit more about it as well. But I'll try my best. I've been exposed to most of these, so I'll try my best to explain a little bit of each. And then corporate wellness and other providers. So interdisciplinary practice is also very much on the rise. So we need to be able to communicate our roles and responsibilities as physical therapists to these other providers so that we can work together. This is where, when technology needs to be invented, bioengineers and physical therapists can come together. There's also a need for outcomes-driven research. So physical therapists have to document patient change, patients' function, and how they're improving the patient's function in more than subjective measures. So it's not only the pain, which is more subjective. How much do you have the pain on the level of 0 to 10, or the location of pain or the quality of pain? You need to go beyond. So you need to have some functional changes. And that's where outcome-driven research becomes very important. The clinicians have to, again, there's several outcomes, thousands of outcomes that exist. You need to be smart to be able to pick the right outcome with respect to your patient's findings or patient's complaint, and therefore effectively document clinical change. Outcomes-driven research is very important. It doesn't have to be research. A clinician can be consuming and using those outcomes, but those are very important to reduce any unwanted practice variation. So when I say the person has been able to perform walking 10 meters in 4 seconds, anybody else can also understand what that means. So it needs to be used within the continuity of care, as well as minimizing that variation across practice. There's also a need for telehealth and legislation. I think we all understand what telehealth is now. And again, we can discuss all about it. I was the one who established that at my clinic as well. So it was very interesting. It's been very fruitful, which was not expected. So there's a need, and there's now, in the US at least, a lot of push towards using telehealth more and more. So we can talk about that. But it definitely has improved access and has improved a lot of the other things that I listed already for my patients. And there's also a need for using technology for student teaching and for clinicians just in general to keep up with the patient. I have patients who use activity monitoring like Strava, and I had to educate myself on that too. So students, how do you teach the students all about this technology as they become physical therapy professionals after 4.5 years of their bachelor? So I think I've made my case for the need to stay with the time. It is a digital age, and we need to learn a lot about technology, whether we like it or not. There's a lot of resources that are available for you, and I think many of these are free resources. I made sure that you had some free resources listed. Of course, the website, I continue to add about telehealth, et cetera, that I've been able to do at my clinic. The one that's paid, I believe, is the apta.org first. They may have some free resources, but feel free to click on it and explore that webpage. Okay, so different forms of technology, and I have pictures, I think after a couple slides for all of these technologies. The first trend we were talking about, what are the different technologies that we're using in clinical practice at this time? Are those evidence-based? Have they been proven to improve clinical outcomes? Et cetera, et cetera. So those are the clinical questions that you're always asking. Will this really make my patient better or better faster? Okay, so that's what you're asking. And or assessing my patient at a different level than I'm not able to do in clinical practice. The list that I've given to you in this slide are all technologies that are available to us with a lot of evidence behind them. So I did not include a lot of evidence on this slide only because these are proven to be effective in several patient populations. So if you have questions about any of these, again, please feel free to bring those up later. The first one is force plates and motion analysis systems. I have pictures for these and I'll show it to you, but I just wanted to list these out. Instrument and walkways and treadmill, neuromuscular electrical stimulation and exoskeletons. These could be rigid or soft exoskeletons. Then body weight support systems, blood flow restriction systems, exergaming or exercise-based gaming, and virtual reality. And then whole body vibration platform. And these are only a few from a list of many. These are the ones that are very frequently used. I think they're not cutting edge anymore. Some of these are, some of these aren't. There's always something new that's coming up in these technologies. There's a lot of evidence behind using phone applications. So I'm not sure if you all are familiar with phone applications that might be developed for physical therapy purpose. There's a lot of applications for how to assess different outcomes in physical therapy practice. So something like how much a person can stand, how much a person can walk, all of those are different outcomes. And if if you have questions about this, I would encourage you to read a lot about outcomes or ask me that later. In neuro-orthocardiac education, there's tons of information that already exists whenever you use technology, whenever you use any form of remote monitoring or application-based rehab like mobile health. There's been improvements that are more than normal physical therapy settings. Now the patients also love it. They preferred the technology or in some or the other form where they could do the home exercise program a little bit better. So when you send the patient home with some exercises to do, they are able to do it better only because the application either stores the videos or explanation about the exercise or has a way to monitor. Did it cause pain? Did it not cause pain? What did you do? Did it cause fatigue? Did it not cause fatigue? So things like those. So patients loved it. In terms of home exercise program and being able to monitor and self-regulate, and they preferred it better than paper-based exercises. They really like the active and direct disease management. So for me to, if I have a condition, I'm able to control my condition better. I'm able to log and report. So if I needed to, if you have a patient who has postural orthostatic hypotension, they could monitor their blood pressure across different positions during multiple times during the day, and they'll have a log report for the healthcare provider. Or they have, let's say, POTS, tachycardia syndrome, then you could do the same thing. What is the heart rate level across different positions, and what are the vitals across different positions, basically. And then they could receive a much better diagnosis, a much better understanding of their condition, as well as personalized information. Now they may not be they may not fit the category of a regular patient of POTS or orthostatic hypotension. Then they could receive individualized information because of the technology use. Patients typically don't like social interaction on these different applications, or sometimes in the use of technology, you can log in like social media and share how much you're active, etc. Patients typically didn't like that. Now, these are where the pictures. I've tried to include all the pictures possible for what I listed in the previous slide. So the first top left picture is about the force platform. These are good because they're a form of a transducer that gives an output that is proportional to the force on the plate when the person jumps or walks or steps on the plate. It has a way to measure the force that's been applied to that plate. And then it can generate things like velocity of motion, power of motion, displacement. If you were to continue to take steps, how much displacement occurred, et cetera, et cetera. So these are typically used in combination with the top right picture, which is the motion analysis system. Hopefully you can see my cursor. And these motion analysis system typically include a lot of markers on the body, and both of these together can give you a lot of information about the force applied. So let's say a person whose knee is hurt, they're walking, and you see that the painful knee is not taking a lot of weight, because every time the person steps has lesser force going through the knee, because it may cause pain every time they put in 50% of the body weight. So that's one way to look at it. Then you can have the sensors applied on that knee and see if that knee is flexing okay, extending okay, what is happening at the hip, what is happening at the ankle. So instead of just eyeballing it, it can give you a very specific measure. Now these measures together can become very cumbersome, because it requires, I've used this in my research for several years, and it requires like a couple hours per person to apply this. Nobody has the time in the clinic. So I've also purchased this body wearable sensor, which gives you same amount of information. They're a little bit expensive, but they really do give you good information about how is the person clinically moving. It still takes 10 minutes to set up, and then quickly 5 minutes to assess if we need to. So it's possible, but again, the technologies exist. If you were to look for using these measures in research, that's typically where they're used heavily, except for the body wearable sensors are used in the clinic quite a bit too. But these are typically used in research labs. Then you see the instrumented treadmills. There's also instrumented walkways. So the person could be walking on a mat with sensors that gives us information about their cadence, stride length, step length. Again, you're trying to provide knowledge to the patient as well as to yourself in assessing correctly what the person is doing, because we are all movement specialists, right? So we look at the movement, and then we're able to figure out where is the movement faulty and how can we improve it using our rehabilitation or our plan of care. So again, you could have a walkway, which is instrumented, or a treadmill that's instrumented. So it has sensors, it has force plates embedded in the belt. The person walks, and you're able to get all of those measures, including walking uphill, downhill, backwards, sideways, as you want to use it. So these are some things that are available, of course, to you. The bottom picture center, in the center is an electrical stimulation set. This is a thigh and knee cuff. I think that's what they call it. It's called a Bioness. Bioness allows you to have a person, I'm not sure if you've worked with those patients yet, but some patients are not able to lift their foot when they're walking, and they tend to drag their foot and are at risk for falling. So this system allows them to have an electrical impulse generated so that they activate the peripheral nerve and or the muscle during that motion, so that it's activated when it needs to be activated, and they're not tripping over their forefoot every time they're walking. So it just generates it's an external stimulus that's applied to the nerve. The bottom left picture is an exoskeleton. This is a soft exoskeleton. So for people who are, let's say for spinal cord injuries, where there's a lot of weakness after a certain level of the lesion, they can have an entire system dedicated for them to be activated in a motion. They're able to walk together. So despite not having a lot of muscle activation, these systems can hold the body weight, depending upon the level of the lesion, of course, and then activate all these groups of muscles so that the person is able to walk. Moving forward, there's so much technology out there. I'm going to spend a little time here. Blood flow restriction is another one where you're mimicking high intensity training. So you can apply a cuff that will stop the circulation at that level, so that when you're working out and you work out that muscle, so when you work out, there's a lack of oxygenated blood because of the working out, and there's a collection of lactic acid, so that simulates a high intensity training environment, and it sends the signaling within the body so that you're able to produce muscle hypertrophy better. So it's a very new, technique. People are using it in patients who are not able to perform high intensity training, because of pain, because of muscle weakness, because of neuro conditions, and even like after surgeries when they're not able to take a lot of weight on that leg, you could do a low intensity training with this cuff applied and mimic it to be a high intensity training, and patients get better much faster. So it's new and it's very active and it's very efficient. There's a body weight support system. So you see how the person could be held in a harness, safety harness, and could be walking in the clinic over the treadmill, as you see on the side, with assistance in a virtual reality environment. So you could have when the person's not safe to be outside in the community, then you could have a virtual reality environment where the person could be walking in the community because of the pictures or the images that are being displayed, and the person's on a treadmill or something, so they're walking or doing activities where they assume that they're in this environment that's like a community. It's mimicking or simulating the community around them. Then there could be XR gaming. So the person could be looking at, Kinect, Xbox, these things that we all know about. Wii Fit, all of those are very commonly used by patients to do exercises. You see that Wii Fit board over here. So they can do exercises, they can work on their balance, they can work on their strength. There's a lot of games that I've used in the past and it works very well. Again, some virtual reality glasses, we are all very familiar now at this point because of technology. You could be practicing a lot of things with those if you have those developed games. The whole body vibration platform, a very good primer for the sensory motor system. You could develop increased circulation or strength or better motor recovery. It's used, and I have used it in the past, and there's some evidence behind it. It just I think the technology is still developing, but it's out there and it's being used. Now, something very new, very, very new, I think in the last 3-4 years, is 3D printing. So physical therapists are now printing plastic molds of things. And I haven't done this specifically, but you can build and create things like splints, I've seen it used for splints, but I can imagine being used for so many things, like a quick exercise equipment or something, a brace. So anything that you want to develop very much customized for your patient, you could automatically do it because of that equipment. And it's available. People are using it quite a bit too. Phone applications that exist, there's so much information. I hope you can stay with me. There's a lot of phone applications that are being used. I've used some of these and I really enjoy using these. One is Coach's Eye, where you can actually look at the gait angle. So see how all of those previous forms of technologies that we had were very much lab-based, expensive. These applications have some evidence behind it. You have to be careful when using them because there's a lot of interpretation and user error. But these applications could very well give you a quick way to look at your patient in the clinic. You just have a good video taken of that person when they're walking towards you from the side, and you just draw these angles and figure out how much hip extension they're lacking, or foot dorsiflexion they're lacking if there was an angle that you're looking at. The same goes for hip adduction. So if the person has a Trendelenburg sign, you could see that hip adduction or that pelvic drop that you may see for that person having weak abductors, and seeing that coronal plane motion of that drop. You could do different activities, not just do walking. You could do a squat. You could do a person raising their arms. This is not an inclinometer, but an angle meter. And again, the app allows you to look at different angles through the joints. It could be single joint, multiple joints, very unique things that you can do now with technology. One application is therapeutic outcomes. It includes a lot of outcomes that are known for, let's say, patients with stroke, traumatic brain injury, Parkinson's, vestibular disorders, multiple sclerosis. So it has like a listing of all the outcomes that have been established. in this patient population, and are they measuring activity, strength, etc., spasticity, whatever. So they have the entire scale listed. It allows you to record right there and then, and also know how much change is required for you to say that your treatment was effective. So it's pretty good as an application. A very quick application that sometimes I've used is a heart rate zone, and that's how much heart rate zone do you have to be exercising within for it to be moderate intensity, high intensity, etc. So something that you can all download and quickly use. And then if you don't want to do any of those, you could just use the activity monitor for your patients. And that's when you're doing remote monitoring. How much are you working? What was your average heart rate? So there's some heart rate applications, etc. On Android as well as I think Apple phones. Apple phone also has an emergency response system. So you guys can tell me if it works in India as well. So I've told my patients, if they have an Apple Watch 4 or beyond, if you were to take a fall and you're wearing the watch at home, the watch will activate itself and ask you if there was a fall. And if you say I'm okay, then it won't call 911. So they won't call the ambulance right away. So it's a good alert system if the person does take a fall when nobody is at home. All right, that was trend number one. There's several technologies that we have in clinical practice. It's totally up to you as a therapist. What do you want to use? The second trend was about telerehabilitation. Now, telerehabilitation is not new. It's been around for a little while, but during COVID, we were all forced to learn a lot very quickly. It's a way to virtually deliver physical therapy services or rehabilitation services to your patients when they're in their home. It can enhance or even replace conventional therapy. I know we don't like to, we don't want it to happen, and we don't like for it to be taking over in-person clinical services. But there's some studies that have shown that it can either be a supplement, but also a good replacement of some conventional therapy in certain populations. You have to be very careful which patient populations are using telerehabilitation for. It can overcome a lot of barriers. So if your patient does not have a ride, they're not able to come because of time they're working, or they're just in a rural setting, that it does allow you to reach those patients and make a difference in their lives. And telerehabilitation softwares, I'm not sure if you've gone over any, but they're very good in terms of monitoring, education, treatment, as well as support. So what that means is that application I'll show you in the next few slides includes everything that you need to know. They're a little bit expensive, so you have to know what you're going for. Not a lot of free apps. The research is limited by the quality of studies. So there's a lot of research that exists in the field of orthopedics, and some other fields like sports medicine. I work in vestibular, pelvic, and neuro, and I've always found less research in those fields. But there's some out there. I've done an entire collection. So it's limited by the quality of studies. We need more studies about the efficacy of telerehabilitation so that we can actually make that statement that it's useful and can replace conventional therapy. So this is one example of a software that allows you to do everything, where you can do inpatient consults. So you can have a calendar and have the patient be sent a link. They just click on the link and they log in into the, they don't have to sign up or anything. They just click on the link and they're attached to the video section of this software. And then you log in into your system, and then the patient's right there, and you talk to them and go through the telehealth setting, and then you can document your notes. You can also show the person several things that are available in the software. You could show them exercises, so see how there's a lot of exercises listed over here. You can go over some patient education. So if the person has knee pain and you wanted them to know what a continuous passive motion is in case they were doing something after surgery, or what knee pain is, or how much movement is required, or how much activity can they do when they have a pain like that, then you can just click on that tab and it'll give you knee pain, and you just send it over to the person. So everything is electronic. You just drag drop here or add it over here. You can manually add notes, and you hit send, and you can send a text message or an email to your patient. The patient education can have videos, can have handouts. It allows you to track. So it's just very useful, as you can see. There's another app that is available that allows you to do a little bit of the same, and then sometimes also allows you to collect outcomes. So if you want to look at the list of softwares, those are available on that web page that I mentioned to you earlier, PT Experts. There's an entire list. There's too many. You can be using Zoom, you can be using Google, but then that's a separate thing that the person has to log in and the exercises are not automatically sent to them. You have to send the exercises separately as an email. So there's, you can do things around, you can work things around. I've done that too. But sometimes a good software really makes a difference. Now, trend number 3. We were looking at, okay, the need for physical therapy profession in India, and continuing education was something, or research or evidence-based practice was something that was required, or determined as a need in physical therapy professionals practicing in India at this point. So, for that, you have to do something beyond your Bachelor of Physical Therapy. So there's a lot of advancements that exist for different fields, and there's some new and trendy specialties that have come about. So I'm focusing on those new and trendy specialties right now. And then in trend number 4, we can kind of list out what are different options that exist for continuing education or practicing per se. Okay, so a PT could be a specialist, as I mentioned to you earlier. There's a lot of new fields that have come up and about, and they're very exciting because I work in a few of them, and I really find that physical therapy can make a huge difference in these patient populations, and has been found to be very effective from several research articles as well. So it works. Now it's up to you if you want to gain that specialty and help your patients. The first one is pelvic health. So in pelvic rehabilitation, you can see pregnant patients postpartum, and in postpartum, you could see prolapse, incontinence, pain, all of that. And then beyond pregnancy and postpartum, you could see pelvic pain and incontinence in general. Like I work with neurogenic incontinence as well. So that could be because of my patients having a neurological condition, have incontinence. So there's a lot to do in pelvic health. And there's a lot of studies that have found the efficacy of pelvic health. And it's an established field over the last 10, 15 years now. In the US, there's an entire clinical specialty exam, like the neuroclinical specialist specialty exam that I had taken. There's a pelvic specialty exam that you could take to become a pelvic specialist. The second one is the emergency department of primary practitioner. So I know it sounds like what a physical therapist could do in an emergency department, but physical therapists are very well trained to see musculoskeletal injuries and determine if that is something that's urgent and requires urgent help, like a fracture or compartment syndrome, acute compartment syndrome type stuff. Those are some things that physical therapists could be very well trained to screen for and refer immediately, so that the emergency visits are properly screened for. The other way is vestibular insults or injuries. Like I've seen patients several times have gone to the emergency department because they've been feeling dizzy and nauseous, and that is mostly sometimes treatable by physical therapists as a vestibular insult, versus them having a stroke that requires immediate and urgent care. So I think a physical therapist can see musculoskeletal as well as vestibular insults, and then there probably are more. I strongly felt about these two, so I included these two over here. So physical therapists could be considered as primary practitioners, where we're screening for these patients very frequently. Vestibular field, again, I told you that I do a little bit of work over there, and there's a lot that's been done already in the field of vestibular therapy. Generally is for improving imbalance and motion sensitivity. Oscillopsia is double vision or bouncing vision. This is generally when the head and eye movement coordination is not there, so then you see bouncy vision, and every time you're moving your head, you're not able to focus your gaze onto a target. And it's very effective. I think it's an established field. Again, I think it's been there for 20 years at least. 20 to 25 years at least. Let's see. The other 3 roles that I felt that physical therapists are very well fitted for include lymphedema certification. So, we all know that there's a, arterial circulatory system, venous circulatory system, and then the lymph-based circulatory system. And there's a lot of swelling that can happen because of that oozing out of the blood from the lymph, system, and from the venous and the lymph system being backlogged and not being able to take it back. So blood oozes out from the venous as well as maybe a little bit from the capillary areas, and then lymph not being able to take back results in a lot of swelling. And the certification allows you to understand how to manage the swelling across different body parts. And lymphedema management and lymphedema certification has been proven to be very effective. It's physical therapists are the prime people that are treating lymphedema, at least in the US. Oncology, because new treatment options are being discovered and there's more and more advancement in the care, including post-surgical options. Oncology has become in its own specialty, at least over here in the last couple years. So it's a very, very new field, oncology physical therapy. Fitness and wellness. I do some wellness with my patients, and I feel like PTs are very well rounded to provide any wellness advice to our patients, where you could look for lifestyle conditions, obesity, diabetes, fall risk, osteoporosis. All of that is very well within our realm for how to progress this person for better health and function. It doesn't have to be that they have stroke. It could be just for better health and function. One new thing that you see on your screen right now is infectious diseases. I was reading an article, and that was a very fun article because it said, after this pandemic, can physical therapy be a specialty for treating infectious diseases? And I think very well you could. I've established a COVID program in my clinic, and the physical therapists again are very well trained to handle these patients. So I think the specialty could exist and could really help moving forwards. But that was just a thought. Nobody has really looked into developing that yet. If you all could just mute yourself because I'm getting distracted a lot, that would be great. Thank you. So the last one is post physical therapy or post physiotherapy options. That's the last trend. So what do you do now? You've done the bachelor in physical therapy. You need to be motivated. There's a need for physical therapists in India. There's a lot of professional concerns only because of the lack of regulation or quality or application to Indian population. That may not be seen by everybody, but just a few people maybe. So what do? You try and go for continuing education. You keep learning. You can go for clinical specialty. You can go for additional certifications that are not clinical specialist based. You could go for post-professional education. So that could include focused, like the masters in cardiovascular that already exists in India, but like focused clinical applications, such as working in the clinic full time. Not even like learning any courses, not taking any courses, but really just being in the clinic under a mentor is what a residency generally looks like. A DSc, a Doctor of Science, or a PhD program, and a postdoctoral fellowship after the PhD. All of those are required for, educational purposes. So if you were to be working as a professor at a university, then you're looking to doing these terminal degrees. So there's a lot of options. Hopefully this motivates you and gives you hope towards the end of this degree. There's a lot of PT practice settings that are out there. Every one of those have a need. Outpatient, inpatient nursing facilities, home-based rehab, acute care is another specialty that's it's been there in the US, but the profession for acute care is changing so drastically because now the physical therapists are seeing patients and directing patients in different areas very fast. So early mobility is what's being recommended, and it's getting very good outcomes recently in the last 5-ish years. Academics, if you want to go the academic route, there's lecturer, assistant, associate for professors. So there's a lot of things that you can do. You could have a private practice and you could own that practice and of course grow in that direction. Or you could just be working as a researcher. There's a lot of occupational options after doing the physical therapy degree. So the whole point is that when we went through the challenges and the needs in the state of physical therapy in India right now, all of these needs could be easily met depending upon the role that you adapt. And I feel like we're in a good place. We can make a difference. We are already trained well. Physical therapy on the day of physical World Physiotherapy Day, we all can kind of realize that we are individuals that help our patients improve their function across different kinds of conditions. And we can really make a difference in different ways for our patients. So at this point, I'd like to conclude the presentation. We have, I think, 15 minutes that we can dedicate to our questions. These are the references, and I'm open to questions. Any questions?
Hello, ma'am.
Yes.
Ma'am, can you tell us the scope of robotics in physiotherapy?
So like robotics, I'll take you through this picture. All right, so see, this is a way of looking at a robotic leg. So you could have a robotic leg, which is in a rigid frame. The person is just, so you just have the person sit, put their legs in the frame, and the robot just keeps moving them. So that's one way to look at it. This is a soft exoskeleton. So instead of getting that person in a rigid frame, you now have a soft, customized, little bit of plastic, lot of sensors and robotic movement taking you through the motion. So an individual with spinal cord injury, if you work with those individuals, they don't have a lot of muscles. Depending upon it's a complete or incomplete injury. Even if it's incomplete, not all muscles are innervated or active. I should say they're still innervated with peripheral nerves. But they don't have that activity because of that injury, that lesion at that level of the spinal cord. So the robotics help the person move through the motion, which is because of the power based on that motor right here, activating the sensors. The motion also activates the sensors. So basically, they do a good timed based motion. That's an example of robotic.
Thank you so much, ma'am, for answering. Ma'am, the next question I have.
Yes.
I want to know more about research options and the topics that could be researched upon. Also, what is the credibility and reliability of all the technical applications in physiotherapy?
So, do you want a list of research questions? Did I get that right?
Yes, ma'am.
I would just say, whatever interests you. I cannot give you a list of research questions because there's too many. There's thousands and thousands of research questions. But related to technology, what you were saying is, there's some credibility. So as I said in this slide over here, all of these technologies have been well researched. There's a lot of evidence behind these. So if you're looking at reliability and validity of these, there's a lot of studies that already exist about reliability and validity of these technologies in certain populations. Now you have to see which populations are you going to use it for, and is it reliable for your population or not. But these have been very well used. Like I have in the clinic, I use it like very frequently. It's commercially available now. The body weight support system, the neuromuscular electrical stimulation, the instrumented analysis systems, like all of these, I know that I personally feel very confident using in the clinic. Any other questions?
The next question we have from the audience. Ma'am, please elaborate more about PT specialization in oncology and how can we contribute in this field?
So in oncology, it's more like pain related science. So you what are the various ways that you can minimize medications and prolong the person's function, providing them with appropriate pain treatment options. So that's one. So I'm not sure where the research is in India, but there's a lot of background research that's been done about where is the source of pain and can you train the brain to interpret a painful stimulus differently. So you could look at there is neurogenic, non-neurogenic sources of pain. Is it cancer-based pain, and what are some of the palliative treatment options so that the person's quality of life is better, minimizing their pain for the time that they have left, or after surgery of different types of cancer, how do you progress this person's rehabilitation back to function?
Thank you so much, ma'am, for the answer. The next question we have, what are the best apps that are free for gait and movement analysis?
Okay, I'm not sure what the question is. So do you have it in the chat?
Yes, ma'am.
Okay. What are the best apps that are free for gait and movement analysis? So, the apps that are free, I can probably give you a list later. These apps are not free necessarily. I think I'll tell you the angle meter. So the angle based app. So if I had my camera facing my patient and I had them do shoulder flexion or shoulder abduction, if I'm facing them, then these are free apps. So most of the angle based apps are free, but anything that you're doing for a video analysis where there's a dynamic motion, I think are paid. Some of them are, I think I have a list. I have a list somewhere that lists out the entire thing. So I'm very happy to post it somewhere on that webpage that you can kind of find it on your own. There are some very little free apps. You have to be very careful. The free apps are very clunky. They don't work well because I tested all of these out at one point. I think it was January of this year for a different presentation. And there are some free apps, but they're not very good. So you have to be very careful when you use them. The angle-based apps are free. So I'm very happy to post their names. I will post the list, Saksham, on my webpage. So I'll have a list of all these apps on the ptexperts.com. So I'll have to make sure that I write this down before I forget. Okay, definitely will write that down, write a list and post it on the webpage so that you can find it. Let me see what's the next question. Working out of India, do you feel better idea to work as physio out of India if someone wants to? So Akansha, this is very interesting because the studies that I've showed you over here about physical therapy, the state of physical therapy, this research is coming from, it's very noisy. So it's very noisy. So can you hear me? I think so.
Yes, ma'am.
Yeah. Okay. So Akansha, this research, this slide that you see is coming from physical therapists that have been trained outside of India, and some of those chose to stay outside of India. Some of those chose to stay inside or come back to India. And this research is I've given that reference, of course, is available to you. They talk about how difficult it is to come back to India only because of the lack of awareness and the lack of standards of practice and the effort reward imbalance. So how much are you being paid for all the effort that you're putting in? So I guess you can read the research. It's hard for me to I can personally tell you that I learned a lot being here, despite I was at BCIP, I was the topper and all of those things, and I still felt that the education was lacking significantly, which is unfortunate to say. I think our curriculum was well designed, but it was very theoretical. Here it was very practical, so I had to learn a lot of it on my own, and I developed a lot of specialties on my own. It was just a lot of learning initially, lot of learning. I can't even elaborate. So I was fortunate, I was able to do all of that. And I think it was good for learning how to really improve your patient's function. But I don't know, maybe in the last 12 years, things have changed over there in India too. So, but I felt that it was a little bit deficient at that time. I will post the list. Yes, Saksham, I will. What has been the change in education system, as you mentioned earlier? I'm not sure what that question is referring to. change in education system here in the US or in India? Sure, that's. Well, the change in education system, at least in the US, I know that at least from what I've seen in the last 12 years, the movement to doctor of physical therapy. So everybody has to have a bachelor and then a doctor of physical therapy, and then you can do PhD or other terminal options like a postdoc. And then, you know, if you don't want to do a terminal for professorship, then you could be a bachelor and then a doctor of physical therapy. That's when you write the licensure exam, become a physical therapist, and then develop residency-based training or become a clinical specialist, as I mentioned. So there's a lot of specialty focus, a lot of training, hands-on residencies that have been developed. So the entire profession has changed in the last 12 years, at least in the US. Now in India, you'll have to tell me how much change has happened. From what I've done, you know, I conduct workshops and seminars quite a bit in India. So it seems like the degree is still there, master's is still there, and PhDs are still there. So you just have to, you know which one's more clinical. I still feel like bachelor gives you the breadth of information and master's gives you that depth of the specific specialty. The problem though is like other specialties are not well established in India. So like pelvic, vestibular, you know, those specialties are not really established much. What is DPT in post degree? That's a doctor of physical therapy, which is equivalent to a bachelor in India. So bachelor is more broad. The doctor here is very much hands-on. It's like MD, you know, so MBBS, MD. We have bachelor and then DPT. So doctor of physical therapy. That's how it is. Patient barriers to adherence, how overcome these challenges. My gosh, there's so many questions. Patient barriers. There's a lot of patient barriers, you know, in my clinic, you know, we try to encourage for them to exercise. As I said, neuroplasticity principles, I'm always like, you know, on it for my patients. Common barriers are for them to come to the clinic, you know, having the time to do the exercises, having the motivation, you know, just ask yourselves. We are all physical therapists, physiotherapists. We all know physical activity is important. Do we all exercise every day? Okay, when you answer that question, really think about what are you asking your patient. You're asking your patient to exercise every day when you don't exercise every day. So, you know, realize that it's tough, you know, so you have to overcome those barriers just by having that conversation. So that's a different presentation for a different day for what barriers are. MSc in physical therapy from USC, equivalent to MPT, is doing MSc in physical therapy, equivalent to MPT course of India. Now, for Aditi, this question, MSc has been waived, like it's been phased out. Nobody should be doing masters in US anymore. They all have to be DPT. Okay, right, sorry. Let me see where the question is. Which master specialization is required most in the field of rehab? You know, orthopedic, I think. Orthopedic, everybody has orthopedic issues, pain everywhere. So that's an easy answer. I'm not sure, you know, how to tell you other specialties are not needed because that's all I do. So orthopedic is still the most common. People complain of musculoskeletal injuries. Phase out of India as a PT, you know, as I told you earlier, the educational curriculum was quite deficient for me. And I had to learn a lot on my own. Change in education system. Okay. Which WES application form for a job in Canada and mandatory requirement of work experience. So in Canada, there's an entire process where you have to have some work experience shown, you know, and maybe we can talk about this later, but you have to have a work interview that has been done, and that's where they explore your previous work experience. Like I have a friend, she's working right now. I think she switched jobs because PT was so competitive over there. Like she couldn't keep up because of, you know, her lack of confidence in providing clinical care. So she switched. So we can talk about that a little bit later because the job interview itself will ask you, like the application form will ask you how much experience you have, but then the interview also, they will ask you, can you actually treat patients? You know, you'll have to kind of establish that I have had that work experience. So So I think that's a requirement anywhere. Difference between DPT and BPT. Bachelor of Physical Therapy is not the same as Doctor of Physical Therapy. Doctor of Physical Therapy is, as I was telling you earlier, like MBBS, Bachelor in Medicine and Surgery, and then MD, Doctor of Medicine. That's how you would think a little bit about physical therapy here. Everybody has to do general Bachelor of Health Science or something, and then come into a Doctor of Physical Therapy program. Now, the curriculum is slightly similar, but the Doctor of Physical Therapy, very evidence-based, very current, very focused on hands-on skills. So that's the difference. Complete entry level, Bhumika, that's a very good question. I've had people do both. I remember I tried to fight for my degree, since I was, in my mind, I was like, I was the topper and everything should be fine, but it really didn't happen that way. Our education was determined to be deficient, and I had to do a lot of, as I said, training on my own. So some other folks, though, they had to redo the entire degree. So I really feel for them, because it's $100,000 over here at least. They had to, redo the entire physical therapy degree. So there's two answers. One is that for certain states, you probably can do some additional training and then go practice as a physical therapist after writing the licensure. The other one is redoing the entire physical therapy, which is now going to be termed as Doctor of Physical Therapy. So I know both kinds of people. And, maybe I should write something on the webpage about, what are the different options. Maybe that's going to be useful, because there's so many questions about what to do after. I think that's all the questions.
Yes, I think we have taken up all the questions. Thank you so much, Dr. Hinna, for clearing their doubts and for sharing useful information with us. It was quite an informative session. I think it helped our viewers to understand the current prospects of physiotherapy, which are trending. It was such a pleasure having you here as a resource, as an esteemed resource person over here.
Oh, I was happy to be here, Priyanka. Thanks. I'll stop my share, but I encourage all of you to ask me questions on that webpage if possible, and I'll be happy to write any information. Now stop the share. And should I just exit the meeting?
No. Just stop sharing.
Okay.
Below that, there would be the green button.
I did.
Thank you, Hina. Thank you so much. It was a great informative session you had shared with all the delegates today. And I know you were bombarded with many questions, and the best part, you answered all of them very patiently, and you are still ready to answer them through your webpage. Thank you for all the help that you are lending for all the physios or your juniors here in India. I think this is the best thing that we could do. We could at least network somebody in US with the Indians here. Yeah, and this will, I think it will also give you a chance to connect with all the Indian students and know about what is happening in India currently.
Yeah, of course. No, I agree. I think I've been doing a lot of work, educational work over the last 2-3 years. I would come to India, do workshops, like hands-on workshops and webinars. So I realized that there's a lot of need for learning about these different specialties, which I didn't realize that in India there was a need. So over the last 2 years, we've been developing a few certificate programs. So I'll, upload that information as well. But there's neuro certification and some other certification that I don't remember that we've developed now. So I'll make that information available.
Okay, hope to see you soon organizing and holding few seminars, workshops with BCIPNs as well.
Oh, sure. Just contact me. Let me know.
Yeah, sure. Thank you so much.
Okay. Thank you. Good luck, everybody.
Thank you, Hina. For all the participants here, yeah, Priyanka ma'am, I think there was a lucky draw which was conducted on the contest that was talked about yesterday. So please go about it.
Yes. Yesterday we had announced one contest, a lucky draw, in which the students had to provide the contact details of some few students. So I would request Dr. Abhi to kindly take out the draw and announce the lucky winner.
Okay, thank you, ma'am. Here we have all the four chits. They have received the 4 entries yesterday, so I am going to pick one, the lucky one. Okay. So I'm going to show you the name. What is it?
Turn it around.
Sakshi.
Sakshi.
Yes.
So Sakshi is the lucky winner for 7th September 2020 lucky draw contest.
She's from which college?
Dr. Avi, can
One
you
second. One second, ma'am. I will let you know. 1 second.
So she has won the 500 rupees gift voucher.
Sakshi is from Kailash Institute of Nursing and Paramedical Sciences. Kailash Institute.
Okay. I don't know, Sakshi is here today. Let us congratulate Sakshi. She is the winner of
No, I
yesterday.
think she is not.
Sakshi, are you here? She might be on YouTube Live. Continuing the same legacy, we would be extending our contest for today also. The student who will be providing the details of 25 physiotherapy students who are not registered for this webathon will get a chance to win win rupees 1000 voucher. They have to provide the information, the name, contact number, email ID, their college name to the email ID avichaudhary@bcip.ac.in. We will be floating the information in the group as well. You have to provide the information of 25 students who are not part of this webathon to win 1000 rupees cash voucher.
Besides the ongoing contest of 10 students and winning 500 rupees gift vouchers. So if you give 10 contact details, you get 500 gift voucher. And if you give 25, you get 1000 rupees voucher. Stay tuned for our next webinar tomorrow. Priyanka, that is, please share the details.
Tomorrow we will be having a webinar on international prospects of job and educational opportunities in Canada. So stay tuned here. We will be sharing the link details on the group as well. Thank you so much everyone for joining us. Have a good day.
I hope the feedback was
Happy
shared
World
today.
Physiotherapy Day once again. We have shared the ma'am today's feedback.
Yeah.
We have already shared today's feedback and attendance.
Yes, ma'am.
Kindly fill it. I'll share it again with you. I think we can conclude our session for today. Thank you, everyone.
Hanji, ma'am. Okay. Thank you.